let me introduce myself. My name is Lopa Bhattacharjee, and I'm the director of the Alliance program at Family for Every Child. This webinar series is the second on kinship care that will usually happen on the last Wednesday of every month, running up until July 2023. The webinars are taking place in parallel to the development of global interagency guidance on kinship care, which is being led by Family for Every Child. Family for Every Child is a global alliance of currently 46 local civil society organizations in 38 countries. In 2019, Family commissioned a research on kinship care, which showed that this vital form of care and protection for children is widely neglected around the world. This publication, called The Paradox of Kinship Care, made a strong case for greater investment in kinship care. Georgina will share the link in the chat box. Thank you, Georgina. The guidance and webinar series now seek to demonstrate how to effectively support kinship care. If you would like to get involved in the development of the guidance, you can do so by joining the kinship group on the Changemakers for Children platform. We will share regular updates and opportunities to input and comment on the guidance. We aim to publish the guidance in about August or September 2023. In the first webinar in this series, we looked at what kinship care is, the different forms of kinship care around the world, and how support needs vary by context. Today's webinar examines how kinship care needs to be addressed in policies, legislation, and guidance, and explores the roles of social workers in supporting kinship care. We will draw on examples from Kenya, Ecuador, and South Africa. As previously mentioned, please add any of your questions in the Q&A box, and we will come to these at the end. I will now hand over to Emily Delap, who will be moderating today's session. Emily Delap from Child Frontiers has been working over 20 years as a researcher, policy advisor, and program manager, focusing on child protection in developing country contexts. Family for Every Child is collaborating with Child Frontiers in the development of this guidance. Over to you, Emily.
Thank you so much, Lopa. As Lopa mentioned, we're going to have 4 panelists speaking today as part of the webinar, and I'll introduce them as we go along, but that's just a brief explanation of the panelists that we have involved up on the screen. First up, we have a presentation from Masreen Utugugu, who is a project coordinator for investing in children and their societies in Kenya. And Masreen is going to talk to us about kinship care policies and guidance in Kenya. So over to you. Please tell me when you would like me to move my screen, slides forward.
Thank you so much, Emily, and thank you, everyone. My name is Masreen Utugugu. I work for ICS Africa, Investing in Children and Their Society in Kenya, a project coordinator for Changing the Way We Care initiative, where we do issues around care reforms and also the alternative care for children. So you can move to the next slide. So about my presentation today, I would like to share with you a brief introduction of ICS, Investing in Children and Their Society. I will also give the definition of kinship care in the Kenyan context, and also I will be able to share I will be able to share kinship care as outlined in the Kenyan policies and laws. So ICS, as said, is investing in children and their society. We are a local NGO that works in Kenya, registered by the Kenyan government. And as an organization, it is important for us that every child reaches their full developmental potential. As an organization, we want a world where our vision is a world where every child grows up in safe and nurturing family environment. And for us to reach our vision, we facilitate and empower parents, caregivers, and all stakeholders to create safe and nurturing environment for children. So the challenges we address in Kenya as an organization, we know that there are high rates of family violence, and we address this through, we have a positive parenting module where we are able to reach to our caregivers, our parents within the communities to be able to address issues around separation of families, issues around gender-based violence. We also address violence against children, working with schools and also working with families. We also address economic stress and food security through various family strengthening interventions that we do with the communities that we work in, and also we do with the caregivers and also the children. And also we address issues around limited access to quality services like child protection, looking at early childhood education, issues around education of the children, health, and also nutrition, legal, and psychosocial support. We also address harmful cultural and gender norms. For instance, we address factors like institutionalization of children, which is also a harmful practice. We are also looking at addressing intimate partner violence and other forms of gender norms. And also we look through inadequate implementation of policies and laws, and we participate in those processes. We do a lot of advocacy to ensure that these policies and laws are implemented. So that is what we do as an organization, and we address these various challenges through different projects in Kenya. We cover like 7 regions within the country. So I want to take us through the definition of kinship care. So in Kenya, according to the Alternative Family Care Guideline that was developed in 2014 in Kenya, kinship care definition is divided into 2 forms, because we have the informal kinship care and also we have the formal kinship care. So when we talk about informal kinship care, we are talking, it's a private arrangement within the family whereby a child is taken care of on a temporary or a long-term basis by an extended family member. So this is always an arrangement between family members, and sometimes there is no, it is not ordered by any administrative or judicial authority. For instance, a child living with grandparents, aunts, uncles, older siblings, cousins, without a court order. So when we talk about formal kinship care, we are looking at arrangement ordered by an external or administrative authority. For instance, it can be judicial authority, it can be the local government, whereby a child is taken care of on a temporary or a long-term basis by his or her extended family. So this one is usually through a court order, or the child is living with, for a child to live with their grandparents, also to live with their aunts. It can also be through administrative authority, for instance, the local government within our communities, for a child to stay within a particular community. Next. So the practice of kinship care, it's in the Kenyan society, Kenyan society places enormous value on the role and responsibility of extended family. So I can say that communities within Kenya historically and traditionally cared for and protected orphaned and abandoned children, abandoned and vulnerable children within the extended family. This was a natural factor and a natural event that usually happen without any authority. So it is something that it's historical in Kenya, and it's something that happened naturally within our communities. So in 2020, on the onset of COVID-19, through the government directive, in where we work, in a county where we work in Kenya, close to 1,007 children were released from charitable children institutions or orphanages back to their families. And at that time, almost 48.8% of these children were placed under kinship care in Kisumu County. So looking at the children that were released, looking at the graph on my screen, children were released to kinship care, others were released to foster care, and others were released for guardianship. But we had the highest percentage of children being released from this institution back to communities, more so to kinship care placement. So still on the practice of kinship care in Kenya, between 2020 to 2022, out of the children that were released through case management process for integration, 256 children have been reintegrated and retained within the family. And out of the 256 children, we have 23% of these children have been placed under kinship care. So kinship care has been key in terms of retaining children within families, children who have been released from charitable children institutions or orphanages back to the community. And if you look at the data, majority of these children that were released have been retained within the family. Close to out of 256, out of 63 who are placed under kinship care, 34 of these children live with their grandmothers, and we have 18 who are living with their aunts. We have 5 living with their grandfather, and also we have 6 living with their uncle. So our data source is that we have a case management database where we place, where we indicate the type of placement where a child is. So I want to take us through the legal framework in Kenya and the policy environment within Kenya in the Kenyan context. So I will start with our constitution that was launched in 2010. Article 53 of our constitution, firstly, it indicates that all children have the right for parental care and protection, and it's also give out the primacy of the family. So our constitution clearly articulates that children should be in families, and if at all the biological family members are not there, so a child should be taken care of by an extended family member. And then going down, we also have the Children's Act 2022 that was launched last year, that is in July. So in our Children's Act, every child whose parents, it states that every child whose parent or guardian is unable to maintain the child has a right to social security as guaranteed in the Article 43 of our Constitution, without prejudice for generality or subsection. Social security include alternative care provided by this act and in particular. So the Children Act also state clearly that children should be taken care of. If at all a child does not have a biological parent, it's clearly clear that a child should be placed under alternative care. And the Children Act also recognizes kinship care as one of the alternative forms of care for children. Then going down also to our the guideline, the alternative family guideline that was developed from the UNHCR guideline. It emphasizes also the primacy of the family care for children and the importance of family preservation and reintegration. The guideline also defines both formal and informal kinship care and how it works and who qualifies to be a kinship carer. So in the guideline also we have the alternative family care, standard operating procedures on kinship care that clearly states how kinship care should be done and who should be a kinship carer, how we can formalize the process of kinship care within our Kenyan context. And then looking at the legal and the policy framework still, we have a framework on the National Child Protection System for Kenya. So in that framework, the efforts to protect and promote child rights must be family and community based. An effective child protection system that services are located close to family and the community. So through such arrangements, informal networks of extended family, neighbors, and community members can be strengthened to care and protect children from violence and exploitation. So these frameworks also give the primacy of the family and the extended family members to take care of children, especially those children in need of care and protection in cases of violence or exploitation. Then we have the National Plan of Action for Orphans and Vulnerable Children. So from the Plan of Action, orphans and vulnerable children in Kenya has a priority areas which include strengthening of families to take care of the OVC. So strengthen and support the structures. It's also state on strengthening and supporting the structures, community systems that take care of orphans and vulnerable children. So this national plan of action for orphans and vulnerable children, it clearly states that children should be taken care of and the families should be strengthened to be able to take care of orphans and vulnerable children. And this is where also we have our social protection programs where families who are taking care of orphans and vulnerable children are provided with cash transfer so that they're able to take care of these children within the extended family context and within the family environment. So this also provide primacy to kinship care and providing role of the extended family in taking care of children. Then we have the National Care Reform Strategy, which is a plan of action on how we are implementing the care reform system. And care reform is generally systems that strengthen community and family-based care for children. And it has 3 pillars which involve preventing separation of children. It also has a pillar on alternative care where we have the kinship care. And also it involves the tracing, reintegration, and transitioning of institution to provide family and community-based care for children. So the National Care Reform Strategy is a 10-year strategy that started last year in 2022, which will run up to 2032. So the strategy provides a roadmap of care reform implementation in Kenya. It defines the alternative forms of care and outlines the example. For instance, it defines how kinship care can be formalized and both informalized. It outlines the plan of action on how children can be taken care of. So through the plan of action, it ensures that adequate legal and regulatory policy provision to allow the appropriate use of kinship care as a form of family and community-based care. It also strengthens legal, regulatory, and policy provision to provide monitoring and support of kinship carers where appropriate. It also recognizes high level of existing informal care being used as an effective form of family and community-based care for children, and its potential expanded significantly. It also ensures where necessary and appropriate, kinship care is properly supported through increased oversight by the government departments. For instance, the Directorate of Children's Services, Department of Social Development, and area advisory councils. These including a strong gatekeeping mechanism and also monitoring of kinship placement, meaning ensuring that we monitor, the government monitors where children have been placed or children are living with their kin or with their extended family members. So still on the National Care Reform Strategy, it's also provide provision for prevention of separation of children from families and strengthening families and support families in providing kinship care, including social protection programs. It also ensures that kinship care is not over-monitored or over-regulated where there is no need for this, so as to prevent it as being viewed as over bureaucratic and also becoming unattractive to prospective carers. So for whom evidence shows that many prefer informal kinship care arrangements. Then it also provides an oversight and support for kinship care placements. It also outlines the perception that kinship care is natural. So from the guideline, it says that kinship care is a natural process and therefore does not need registration and monitoring by the social workforce and does not need a lot of support because it's something that naturally occurs within the community, as I had explained earlier. So we use case management for integration, so to provide services, and it is through case management for reintegration that we are able to make decisions that are appropriate, that are best interest of the child, to ensure that we do proper placement of children within families. So case management is a process of ensuring that an identified child as his or her needs for care, protection, and support are met. So it's usually a responsibility of a social worker who meets with the child, the family, and other carers and professionals involved with the child in order to access, plan, develop, and refer the child to appropriate services, and also monitor and review the progress when a child has been placed in a family. So the case management guided by the UN core principle, it's guided by UN core principles, the principle of necessity and principles of suitability or appropriateness. So it ensures that before a child is placed maybe with under kinship care, we have to question if it is necessary to place that child or if that placement also is suitable. Before we place a child with maybe probably aunt or uncle, is it a suitable form of placement for that child? So we also have other principles where as we do case management that guide us in terms of child participation. A child has to participate in the process of reintegration or during the process of reintegration. We also have to look at the best interest of the child before placement of a child. We also have to be culturally responsive and also child-centered, and also aspect of looking at we don't cause harm to the child. So the principles provide guidance on some of the factors that should be looked into before a child is placed under alternative care like kinship care. So case management process also provides a platform to engage family members to help them identify their strengths and needs, which are actions and address factors that might have led to separation of children. So it is through that platform that also we are able to determine if a kinship carer is able to take care of that child. We are also able to determine if the kinship carer has some strength that we can build on so that they are able to take care of those children. It also helps us to identify the needs of that family so that we are able to support the family that is taking care of that child better. It also provides procedures for placement and tools used for placing children within the alternative care forms of care like kinship care. So as I finalize my presentation, I also want us, maybe as I reflect on reflection on formalizing kinship care in Kenya. So as I reflect on this, I know I'll provide an avenue for questions, but one of my reflections is kinship is culturally appropriate in Kenya, and it's largely understood by many communities. So as the government, as we ask ourselves why it was important for the government of Kenya to formalize kinship care, we are looking at the factor that it was culturally appropriate and also it's largely understood by the community. It is not something within the community setup, and that's why it was easier for it to be formalized. Then we are looking at formalizing kinship care as enabled documentation and availability of data of children who are under kinship care. And I think this is effective for planning for the government, because if most children are in formalized form of kinship care, that data might not be available. The documentations might not be available. So formalizing this process help us to have the data, help us to have the documentation, and also help the government to plan better, especially if we have social protection programs like cash transfers where the government want to support families to take care of children. It provides an avenue for better planning. Then formalizing the process has also helped in terms of gatekeeping, because gatekeeping is also key. If the local administration knows that we have such number of children, maybe 5 children who are orphaned, and they're staying with such a family, maybe they're staying under extended family with their grandmother, grandfather. So they are able to enhance that gatekeeping that reduce separation of children within the family, because in the context that this is informalized and people just stay with children, sometimes these are the triggers to separation of children within families, because when they experience abuse, they can easily separate within the family. Then formalizing kinship care also, it has provided an avenue for the government also to be able to provide monitoring for the families. They are able to follow up where these children are. And as I said, it's also strengthened, as I've shared, it's also strengthened the gatekeeping mechanism within the context of care. So both formal and informal kinship care in Kenya, it's a natural process, but also as we formalize as we move to a journey towards formalizing this process, this has also helped a lot in terms of planning, in terms of ensuring that we have the data, and also strengthening the gatekeeping mechanisms within our community. So thank you so much.
Unmute. Thank you so much for that really informative presentation, Macrine. I just find it so fascinating how heartening to hear how in Kenya kinship care is kind of represented in policies and guidance, right from the very top with the constitution all the way down to the guidance that social workers are receiving. And it was really interesting to hear your views on formalization at the end, because I know that's a kind of key dilemma that's being faced in countries across the world. So thank you so much. That's really helpful. I'm sure, like me, many of you have many questions that presentation has raised. So please do add them into the Q&A box. And we'll come to those at the end. We're now going to shift from Africa all the way over to Ecuador. And we're going to be talking about gatekeeping and social work practice in relation to kinship care from the experiences of Danielle Children's Fund and the work that they do with government and other agencies. And then we'll talk a little bit right at the end about how they have tried to share their learning and experiences and their good practice across a range of contexts through the Family Power Network. So Helma, maybe you could just start off by introducing yourself, and then we're going to go into a bit of a Q&A session with Helma rather than a formal presentation. So please go ahead.
Thank you so much, Emily. And thank you so much for the opportunity to be here and to listen to all of you. My name is Helma. I'm originally from the Netherlands. I live already for 20 years in Ecuador. And as you said, I'm working now with the Ecuadorian government, also trying to institutionalize actually the alternative care in this country.
Thank you. And Helma, perhaps you could start off by telling us about the work that you're doing in Ecuador to ensure that more children grow up in kinship care rather than in residential care.
Yeah, actually, what we a couple of years ago, the only alternative that we had was more institutional care. So when there was, for example, an emergency, then often the police took the children straight away into institutional care. And it was not that moment of first thinking, what are the needs and what are we going to do? So what we've been working the last few years, and it went actually very fast, implementing alternative care. So family support, kinship care, foster care, although that's very, that's still, very, very small. But also we've been working on gatekeeping practices in this way that this is this solid mechanism that really first analyzes, investigates the needs of the children before we all start running and doing something. So what we've been implementing now is what we call investigation and analysis. So when there is an emergency, the police does not take the child straight away to the institutional care, but what we try to do is first talk to the police, see if we can get a team in with the family, see what's really happening at their own home, not taking the child out. And if you really see that the risks are too high at this moment, then the police takes them to first like a temporary shelter. And then we do the whole investigation and analysis. So the idea is really working together at that moment with the family, relating to them, having dialogues with them. What is necessary? What do they need? And then send a report to the local authorities where the child protection measurement is being defined.
Wonderful, thank you. And can you tell us a bit more about how you support those kinship care families? I know you take a very strength-based approach in working with those families, so please tell us a little bit more about that as well.
Yeah, that has been quite, it has been a big process. And I was very, when Macrine was talking, she was talking about how can we not over monitor and over-regulate kinship care? How can it be natural? And that's something we have been thinking a lot about as well. There's an author, and he wrote once, and it's in my own words, but it's about that, do not try to convince. If you try to convince someone else, you try to colonize his mind. And sometimes that has made us thinking a lot with the families we're working with, because we felt at a certain point that we were like in a vicious circle. We had this very good intentions that they would have a better life. So we were thinking for them, but they didn't do what we were thinking. And then we always blame them and saying they are resistant. It was interesting because one of the authors I've been reading a lot is Harleen Anderson, and we work once in a while with her as well. She said there are no resistant families. There are only resistant professionals. And then the question is, what do we do in a relationship? So what happens that we come into this vicious circle where actually nothing happens? The professional with all his knowledge, with all his good intentions, and the families not executing or realizing what was suggested. And the answer was that we had to change relationship. That we really say, okay, what is, it's about the family, and how do we guide and help them in the process where they can make the changes they want. So it was more about, it's maybe a bit contradictory, but it's not about changing families. It was more about changing ourselves as professionals. And it's not about what we do, but how we relate to the families.
Wonderful, thank you. Maybe you could expand on that last point a little bit more about how professionals have to work in order to be able to work more effectively with kinship carers. I mean, what skills do you think that they need? How do you think those skills might be different from, say, working with a foster family or in residential care, or even with parents? What are the kind of specific skills or approaches that social workers require?
I think when we come from university, we often come with this, I don't know whether it's like a backpack that you have to know, that you have to be the expert, because that's what they teach you. And maybe it's starting questioning that, and say, do I really know what the other person needs? Or is it more that I do have a lot of knowledge, but how do I put it in the relationship? Because often the families, what they need is like a conversational partner where you can reflect together, because a lot is happening, a lot. I mean, the families we work with, they haven't gone to one thing, but I mean, it's from generation to generation. And then having this conversational partner where you can reflect together and where you can also see maybe other possibilities than what always has been. That is where we try to work on, that we don't come up with the solutions, but that we facilitate this process of dialogue, and then seeing and also having other voices involved. So that, for example, what does the neighbor think? What does the best friend think? Because they are very important. It's not about our voice, it's about their voice, their voices. And what we always try to do is get more voices in, because when you have more people, you have more dialogue, there are more possibilities. So the family is really, the central, and we can, of course, I mean, it's not that we do not know when we come from university, but it's the way how we put it into the relationship. And for example, when we are in a conversation, then we can say, okay, I mean, I'm thinking about this and this. Would you like to know a bit more about it? And when they say, yes, I would like to know more about it, of course we can put our knowledge, but it's very much like it's coming from them and not so much from us. And it does mean that we're working a lot with the team in reflecting what are we doing, how are we doing. We do a lot of, for example, interventions that we talk about the situation. We often invite the families so that we do not talk about them, but talk with them. And then we share with them our thoughts, and we ask them at the end, is this maybe useful for you? Or do you want us to go somewhere else? Because they need to lead the conversation. So we do also a lot of trainings where we think about the processes and also about collaborative and dialogical practices. And we also ask always our the people we work with to have their own personal process as well, because a lot is happening with ourselves, and that's also in the relationship. And you cannot say, okay, I block that, and that's not there. It is there. So it's very important to also do your own personal process.
Thank you so much. I think that really resonates with what I've been reading about kinship care in many different countries around the world, that kinship carers bring with them so many, a willingness to look after children and many, many strengths that can be built on, but also they may have a kind of mistrust of the kind of formal social work system and a fear of the state intervening in the family. So that kind of approach with dialogue and a more strength-based approach, I think, is particularly suited to working with kinship carers. Thank you.
And that's why what Macrine said is so important. How do we keep it natural? Because you can almost kill a program as well if you come in from outside. And therefore, it's so important that you have humane relationship. There is the same Harleen Anderson. She always uses the metaphor of being a guest and a host. And for example, when we are social workers, we have our list, isn't it, with all the questions we have to ask. But the thing is, when I'm a guest in a house, I do not go straight away to the bathroom or to the bedroom and look there. And that's the same with our questions. We cannot ask, we first have to build a relationship of trust before we can ask all those questions. And you cannot go to the most maybe intimate questions. You cannot ask them straight away. You first have to build a relationship. And the interesting thing is that when you focus first on the relationship, then the results comes automatically and naturally in, because people will tell you a lot more than you want to know, in fact. But it's having this basis of trust. And that makes that, we always, when we work with our team, we say, okay, we are guests in the lives of the family. So how do we behave? How do you behave when you are a guest? And that has helped us a lot in that way.
Thank you so much. Time's running out, unfortunately, so I'm going to move on to Anne now. I know that you've been working hard within the Danielle Children's Fund and more widely to try and kind of share this approach and understanding around kinship care. So Anne, do you want to introduce yourself and tell us a bit more about how you've been doing that and about the Family Power Network? Oh, Anne, I don't think we can hear you, but you're not on. I can't hear Anne, but she's not on mute. Can others hear her?
I can hear Anne, yes. Yes.
Oh, you can. Okay, that's fine. As long as other people can hear. Go ahead, please, Anne.
I can't hear Anne either. Anne, are you in the English channel? Not original audio.
Okay, fantastic. Yeah, maybe Anne, you could just go into the English channel.
Can you hear me now?
Yes, perfect.
Yeah.
Wonderful. Please, no problem. Please go ahead, Anne.
Yeah, so once again, thanks a lot for the invitation to be here today. My name is Anne. I'm indeed the coordinator of the Family Power Network. I'm also part of another organization called Kids Care. They are doing kinship care in Kenya, and that's actually a bit where it started. 2 years ago, we as Kids Care were wondering like, okay, what is it what we really need, or what have we been lacking over the past 10 years? And that was to collaborate with other like-minded organizations, to really exchange with each other. What are we doing? What can we learn from each other? What are the challenges we're facing? We really had the idea that a lot of these like-minded organizations were all a bit operating on their own little island or within their own bubble. And we thought, or at least our organization was, and we thought, let's just reach out to others and see if we can come up with a collaboration. So amongst others, we reached out to Helma from Daniela's Children's Fund, and together with in total 9 organizations, we developed the Family Power Network. And we've been collaborating with each other for 2 years now, actually in 3 main fields. The first one is research. So we've been looking at the approaches of the different organizations and what could we learn from that. Together, we've been focusing on awareness. So how can we create better awareness about that this family-based care or kinship care is possible, and how is it possible? And the third one was a more intensive exchange of experiences with each other. So every month we came together in a Zoom meeting with people from all over the world, because these 9 organizations, they come from Asia, from Africa, from Latin America, from Eastern Europe. Very diverse, and therefore also very rich conversations to have with each other. And because we really felt that this was very valuable to exchange with each other, and that's why we decided to come up with a more, formalize is the wrong word, but we wanted to make it a bit more structured. I think that's the better word. Learning program, and that became the Mutual Learning Program. And actually we're doing a little bit the same, but now every 6 months we have a new group. Right now we just started with a new program with 20 organizations from all over the world doing family-based care, kinship care. Some of them are in institutional care, and exchanging with each other, what are we doing, and what can we learn? So within the Mutual Learning Program, we also come up with a more structured way of learning with different topics, etc. But the idea is still that we connect and we exchange, and we can learn so much from each other. And Helma just shared about the richness of having different voices, so within the contact with the families, but we also really see how this benefits the conversations between different organizations, because even when you are very different, I mean, an organization in Africa is completely different compared to an organization in Latin America, but whenever you exchange, you can learn so much.
Thank you. Thanks, that's wonderful. And I know that you've been posting on the Changemakers for Children group about opportunities as they come up. So Lopa mentioned that group at the beginning of the webinar, and I think we've posted how you can join that. So please do join that group, and then you'll see the opportunities that emerge to kind of to benefit from this wonderful network that's been developed. Thank you. And it's so I think this webinar is illustrating that although we're talking about very different contexts, many of the challenges that people face are quite similar across settings. So this cross-country learning, I think, can be really useful. We're going to shift again back into an entirely different setting, this time going over to South Africa, where Duncan Andrew from Tandanani is going to tell us a bit about their work around kinship care, and particularly the work of community field workers in supporting kinship care. Before we hear from Duncan, we're going to try and play a video if technology allows us. So I'll hand over to Georgina to try and do that if that's possible. And then just to let you know, while she's doing that, there may be some issues with the interpreters being able to keep up with the content of the video. So right after the video, we're going to summarize kind of the key points that emerge from it, and we'll try and share it again so you can watch it kind of at your own pace as well. So yeah, please go ahead and play that.
Here in KwaZulu-Natal, South Africa, the seemingly endless cycle of poverty and HIV continues to undermine the ability of children to live full, healthy, as well as meaningful lives. Millions of children still live in poverty, and nearly a quarter have been orphaned, mostly by HIV and AIDS. Children often live in informal and overcrowded households, and many go without meals on a regular basis. This is why Tandanani Children's Foundation exists, to strengthen the capacity of families to respond to the basic needs of the children in their care. Tandanani's Family Strengthening Project addresses the family's immediate needs and moves them from a state of vulnerability to increased stability and self-reliance over a 3-year period. This is achieved through a structured, time-limited, and holistic package of support.
When we become aware for the family that is struggling to provide for the children in their care, the first thing we do is to work to improve the material well-being of the family. If needed, we provide the family with a basic household equipment and food vouchers while we are assisting them to secure the government grants that they qualified for. We help them to establish a food garden which help the nutritional needs of the family and encourage their participation in a self-help group.
These are community-based groups that give participants access to self-generated savings and self-regulated loans, which they can then use to meet basic needs or as a capital to start income-generating activities for themselves.
During our early stages of support, our health outreach staff member visits the family to do health assessment and health education. This ensures that any health issues in the family are properly identified, addressed, and well managed. After this initial assessment, we monitor the physical well-being of family members during our regular home visits. Tandanani also regularly monitors the school attendance and performance of children. We support and provide school uniforms when needed. This encourages school attendance and prevents stigma and discrimination at school. Our home-based early childhood development program also teaches caregivers the importance of bonding and stimulation in the formative stages of young children's development. This program teaches the children how to make educational toys from waste material and to use these to teach their children basic concepts like numbers, colors, shapes through intentional play.
As all of the families we work with are caring for at least one orphan child, Tandanani also works to strengthen the emotional well-being of the family. We facilitate life skill groups, caregiver support groups, and children's support groups in the communities in which we work. We also work with families to create memory boxes to honor and remember those that they have lost. This strengthens the relationships and brings the families closer together. It helps them to share their experiences, process their loss, and build resilience. Once our families have received the full package of support over 3 years, are stable, and can meet the basic needs of the children in their care, they exit our system. This ensures our families do not become dependent and allows us to redirect our resources to families in need.
In the last 5 years, Tandanani has provided support to over 10,000 beneficiaries through its Family Strengthening Project.
Thank you. Thank you. That's such a wonderful video and so lovely to see that beautiful South African countryside as well. Duncan, could you just very quickly kind of talk us through the family strengthening model in case people kind of missed that from the video, in case the translation wasn't quite keeping up with the pace of the video?
Sure. So in a very simple summary, we have a package of support that we provide families caring for orphaned or vulnerable children. The support over 3 years, and it has those 4 main focus areas: the material well-being, the physical well-being, the health of the family, the educational focus and needs, both early childhood and schooling, and then the emotional side of things. So in that sense, a very holistic package. And there are criteria for families to come on. As the video said, up until very recently, all the families we support have been caring for at least one orphan child. Most often, more than 80% of the time, it is a biological kin that they're caring for.
Thank you. Thank you. That's really interesting. Perhaps you could tell us a bit about how you came to this model, what you've learned over the years about how to effectively support kinship care families.
So it was really interesting because the model's really evolved rather than arrived, as it were. We didn't arrive at the model, it's involved. So just very briefly, Tandanani initially was formed by a group of people who just volunteered to try and provide some support to children who had been abandoned in a local hospital, mostly around HIV, as a result of HIV. And then for various reasons, very interesting history, but I won't go into it, that group of people recognized that this problem was just going to persist unless we started working in community, and that's what we did. That was probably like 30-something years ago that we started doing that. And then as we've engaged families and communities, so we recognized and said, okay, they need material support to start. So that's where we started. And then they need health support because HIV is an issue, but then malnutrition is an issue, and so it just grew over time. And as an organization, we've added services over time to offer this full package. So it's not something we arrived at. I think it was Halma who said it's through relationship and through identifying and what people need and what the issues are that families face that this model has evolved.
And can you tell us a bit about the role of the community volunteers or paraprofessionals that you have involved in the project, and the role that they play and how important they are for delivering your model?
Sure. So I have mentioned that Tandanani started with a group of volunteers, and when we were an infant organization, as it were, that was our system. When we entered into community, we looked for people in those communities who had a passion for helping children and families, and we started working with them, and they were all volunteers. And probably about 10, maybe 12 years ago, we were in a position to translate those volunteers into actually part-time staff members. So they all get formally employed and are salaried on a part-time basis. And so these are all folk who live in the communities in which we work. They know the neighborhoods, they know the communities, they know the issues, they know the stakeholders, they know the local leaders, etc., etc. And we invite them in to become part of our program. There is a little selection process, and then we offer internal training to all of them in our model, in our various activities, and we then ask them to go out and, based on our criteria, to identify families in their communities who are in need of the sort of support that we get. Our full-time staff then will go and assess. We have a whole information gathering process, and we gather a whole lot of information, and then assuming that they do qualify, they come onto the system. And it's our field workers, those residents in the communities, who deliver probably 90% of the support to the families. They're backed by our full-time staff, some of whom are social workers, and each of those staff will probably take care of 3 or 4 of those field worker teams like that, and they provide the guidance and the support from our side, but it's those field workers who are the primary service deliverers on our part. Yeah.
And you mentioned that they come from the communities where the kinship carers live. How important do you think that is for their role and for them being effective, that they're located in the same communities?
I think it's incredibly important. First of all, just logistically, we're sitting at the moment with about 35 field workers like that. So if they had to be office-based and come into town and then go out and do their work back in their community. It doesn't, it just doesn't make sense. They're very familiar with the community. The community knows them. So they in a way, they form a safety net in that community. So even if a family is not part of our program, people know who Tandanani's field workers are. If something happens in a household, they'll often report to a Tandanani field worker first. And then we assess that situation and respond to whatever that issue is. So for us, it's very, very, very critical that they're in community.
And what kinds of sort of skills or expertise or personalities even are you looking for in those field workers, and how do you help to build up those skills?
Okay, so what ideally we'd like folk to finish schooling if they're going to be a field worker, but we do have folk who have only finished 10 years of schooling. Most have finished 12, and a few might have some sort of post schooling qualifications. So that's sort of who we target. Age-wise, I'd say most of ours are under 35, so somewhere between 20 and 35, so fairly young. And very often they're unemployed, most of them, or in part-time employment only, so they have some time, even though they may themselves have some children and family members that they got to care. And I think the part-time nature of it suits that for them, and that's why we actually get quite a few applicants every time we've got a vacancy. In terms of the training that we provide, it is in our model and it is in the delivery of those different services. We do both theory, and we pair them with more experienced volunteers, and they do home visits and they learn the ropes through hands-on training, as it were. The one bit of formalized training that we do is in the health sector, because they do home-based health education, screening and testing, including HIV testing. They do go on a formalized training course to be certified as lay counselors, and that enables them to conduct all those screenings and that in the household. And then, yeah, occasionally there will be opportunities to send some off to more formal training programs, workshops, that sort of thing. And where those opportunities arise, we do send them off.
Thank you so much. Thank you. I'm just keeping an eye on the Q&A box because I think it's time for us to now move into that section of the webinar. We have had some questions, some of which have been partially answered, but I think probably we need to revisit some of those. So I just wanted to go. Sorry. There was one question on here about, which I think is applicable to all three contexts, in terms of the financial support that is given to kinship carers to encourage or support placement in kinship care, particularly as opposed to institutional care. So perhaps I'll start with you, Duncan, because I know that this support is available in South Africa, so you can tell us a bit more about the new Kinship Carers grant. And
yeah, I can't remember, but it's probably at least 10, if not longer. Ago, the government
released
opened up the.
We can hear the French interpreter. Dave, we can hear you in the English channel.
Okay, sorry, I'll just fix that now. 1 second.
No problem.
Okay,
so please go ahead.
They opened up the formal child protection foster system and recognized kinship care as part of that. So suddenly anyone who is caring for a biological kin could also receive the foster care grant, and so that brought a whole lot of folk into the care system. More recently, it crippled our care system. It's really a lot of cases, foster care system. So more recently, changes are starting to be introduced where kinship care is being separated out from the more traditional foster care, where child protection is critical there. And it's recognizing, as Macrine said, that kinship care is a very natural part of our community life here. And it doesn't require the same level supervision and support that a child protection type case does. And so that's starting to happen. And the government, instead of in going forward, instead of kinship carers getting the full foster care grant, they're more or less going to get about half of that amount for every child that they are caring for of biological kin. So that's a change, but they're still going to get support. It's reduced, but it is still support that's available.
Thank you. How about Helma over there in Ecuador? Is there any financial support available to kinship carers there?
Yeah, there is a grant, but it's very, very, very minimal. And it just means that we try to work a lot on more strengthening the network around the family. So that's where our focus is, because with the grant, they're not able to survive. So it's really working with other organizations, with the community, so that they, and also empowerment, economic empowerment, so people can find and create their own work, because there's a lot of informal work in Latin America.
Thank you. Makreen, how about over there in Kenya? Is there financial support available to kinship carers there?
All right. Thank you so much, Emily. As I said in my presentation, the National Plan of Action for Kenya provides how to strengthen families who are taking care of children, especially orphan and vulnerable children, because back in 2004, due to the high number of orphan and vulnerable children due to HIV and AIDS, the government came up with the strategy, the plan of action on how to support children who are orphaned. And we have the social protection program, basically for families who are taking care of orphans and vulnerable children, who are provided with what we call the cash transfers, a certain amount of money, like $20 per month. But this is not this is not quite conclusive in terms of it's not enough, because we have quite a number of children who are orphan and vulnerable. So I think with the launch of our new Children Act last year in July, and also having the National Care Reform Strategy, I think once these plan of actions are put in place, and then the government will be able to finance more families so that children are more supported within that context, and even family taking care of those children here.
Thank you so much. Again, as I'm reading up on kinship care around the world, I mean, I'm seeing lots of debates and dilemmas about financial support for kinship carers. I think it's one of the kind of key areas where kinship carers need support. It's expensive bringing another child into your home. Many have to suddenly stop work. But it can also be a huge challenge for governments to meet that support in countries where kinship care is extremely common. So it's kind of balancing those needs. Okay, that's fantastic. So we've also had, I'm just going to check. We also had quite a lot of questions which are partially answered on the within the Q&A box. So take a look at those around this process of registration and formalisation of kinship care. So I'd really like to hear, I know Makreen's answered in the Q&A box from the perspective of Kenya, but I'd really like to hear what's happening in South Africa and Ecuador as well. I'd be interested to hear on your views. I think there are two different types of formalisation that we're referencing in these questions. One is around just registering your child as being in kinship care and in your care. And the other is ensuring that they receive more formalised kind of support from social services and case management support. So I'd be really interested in hearing from Duncan and Helma in particular about how much of that formalisation is happening in your context, and also your views on that formalisation. What are some of the kind of pros and cons of that? Helma, do you want to begin with that one, and then we'll move on to Duncan?
I think in Latin America, in Ecuador in this case, the formalization is still very much at the beginning. Normally kids that are and adolescents that are in kinship care have gone through the child protection system because there was something like an emergency. So there was already a denouncement. It came to the administrative or the judicial court, and then of course the whole mechanism started. What is still a big challenge here is that there is really more preventive support. I mean, just to give you a figure, we have around, in the formal child protection system, we have around 5,000 children, and we have been calculating that approximately 2.2 million children in Ecuador live severe maltreatment in their homes. So it's really a very small percentage. So there is a lot of informal kinship care, but it stays in the informality, where people with their own community are able to take care of the children. And where we're working on with the government is how can we be more preventive so that the children do not have to go through the emergency and then they come into the child protection system. And that's quite a big challenge.
Absolutely. And Duncan, did you want to add something to that from the perspective in South Africa?
I think interestingly for us, it's the other way around. It's like when the gates open for kinship care to receive the foster care grants, the system, the formalized system of going to court and getting an order, that's what activates the grants. So we had families flooding in because they were going to get money, saying, take me to court, I want my order. And that's where the swamp nature of our system came in, and it continues today. The kinship care that I spoke about, that distinction is aimed at starting to address that. So for us, there's been very little resistance to the formalization of the process. In fact, we can't keep up with the demand. Yeah.
Mm. Yeah, certainly, again, from the literature, I can see that there are definite advantages to that formalisation as it brings children into services and support, but also some disadvantages overwhelming the system. There can be resistance from kinship carers, and it may not be necessary in cases where there isn't abuse and violence against children. So I think it's an issue that needs to be carefully thought through. And as I think you're all aware, we're developing at the moment this guidance on kinship care with members of with the panelists and other agencies around the world. So that's one of the areas that we'll be trying to explore and delve into a little bit more deeply. Okay, I think I'm just going to check through the questions. So a simple question: is it possible to get a copy of the guidance and the SOPs? I guess that's from Kenya. I was going to mention this myself because I think what would be really helpful is if we can post those documents that are published on the Changemakers platform. So you'll be able to access it through that. And if you join the Changemakers community on kinship care, you'll also see that over the last few days running up to this webinar, I have also been posting other guidance on kinship care that I've come across from around the world. I found something the other day from Myanmar. We've got something on there from Liberia, something on there from Cambodia. So you can take a look and see how kinship care is represented. And Macarena, I'll be in touch with you. I have some of the documents that you referenced, but I'm not sure if they're all public. Are the SOPs public on kinship care? Can we share those?
Okay, I will follow up to see if it is public, then I can share it.
Thank you. Yeah, that would be really, really helpful because I know many people are looking for that kind of thing. Okay, I think we've probably got time just for one more question, which has again been kind of partially answered, but again, I wanted your views on this. And this is from Claudia, I think Claudia in Brazil, but I'm not sure, around how we define and perceive kinship care. I hope I'm understanding this question correctly, but should we be seeing kinship care as a strategy, as a kind of similar to parental care, and a strategy where we're keeping children in kinship care is preventing them from going into alternative care? Or should we perceive kinship care as a form of alternative care that's very separate and distinct from parental care? Macarena, did you want to, you've answered it partly in the chat, but did you have any views on that, about how you think kinship care should be viewed?
I think kinship care is viewed as alternative care, especially for when we are looking at a child who has already been separated from their biological family environment, because it becomes an alternative form of placement, because this child is not being placed by their biological parent, but they're being placed in an alternative care, especially for a child who has been separated. But for instance, if a child within the community, that child has not been separated, it's still also standing as a form of alternative care based on also the care, because we have a caregiver, or we have an aunt or an uncle who is assuming a role of the biological family. So it still stands in to be the alternative form of placement.
Thank you. Helma, how about for you in Ecuador?
Yeah, it depends very much on the family. I mean, here in the local context, of course, it is very normal that grandparents raise their children. So it's again, how do we keep it natural? And I think if you only want to go with one box that's saying, okay, it should be like that, it should be, for example, alternative care, you're excluding a lot of people. So maybe we have to think really a bit more widely and say, it depends, there are different forms. For some, it is really the way of living. And for others, it doesn't. So I think it's always, we need to meet the needs of the children. It's not that the kids needs to fit in our structures of thinking. And therefore, I think we need to think more creative and say, okay, there are different forms. For some, it's alternative care. For others, it's not. That came to my mind.
Yeah, thank you so much. And Duncan, how about from the South African perspective?
Yeah, I think our major, it's very much similar to Helma in the sense that this is so common in our country that, there's very little distinction between biological and extended family kin caring. And in that sense, it's not alternative, it's mainstream, it's the norm. The distinction that needs to be made, and is being now starting to be made again, is that needs to be seen to be different. Both biological and kin care is very different from foster care in the child protection sense. And in that sense, there are two different support systems and mechanisms that are needed, rather than the difference between kin and biological care. For me, there's hardly any difference there at all.
Yeah, I remember you saying that to me, Duncan, before, about how you feel that you almost offer the same forms of support to parental care, to kinship care, though I think that does vary a little by context, depending on some of the ways that kinship care is perceived. In countries where there's a little bit more stigma, perhaps, and it's a bit more unusual to place a child in kinship care, then maybe those needs are a bit more distinct. And again, this is something that I think comes up again and again. It's very interesting in literature, hearing children's perspectives on this and how they don't necessarily like having grandparent care labelled as something unusual and distinct. They just see it as another type of family-based care. But at the same time, also this recognition that, sometimes kinship carers do have quite distinct sets of needs that are different from parents and might need different forms of support. So hopefully we'll dig into that again in the guidance and in future webinars as well. I think we are just about out of time for Q&A, and I'm just checking. Okay, one more question from Jonathan Hanny, also in Brazil. In light of the last question that's being discussed, do the panelists think it could be useful to look at kinship care in two broad categories, as a child protection measure and secondly as a family strengthening measure? Yeah, okay. Any thoughts on that? You don't all have to speak on this one, but anybody would like to?
I think that's a great distinction, and it's a lovely way. Some families just need support. Some children need protection and support.
Yeah. Any other thoughts on that?
Yeah, Emily, I think also maybe a third category where they don't need, it's just a natural process and they're okay with that. So we don't need to intervene. So maybe three categories in this case.
Wonderful, thank you. Yes, where there's just no need for any type of support. Michael, did you have any other thoughts on that you wanted to share?
No, I don't have. I agree with the perception in terms of there's those children that need protection, and then there are those children that there are those families that just need to be strengthened to be able to take care of those children also. So it goes both ways. Yeah.
Thank you. All right, thanks so much to the four of you for a really, really interesting and informative discussion. I'm going to hand back over now to Lopa, who is, I hope, going to take us just through the last wrap up of the webinar. And I'll just share my screen again, Lopa, to share the final slides. Just give me a second.
Thank you. Thank you, Emily. What an engaging session. Before I conclude, I would just like to highlight some of the key points that I noted from the sessions, and I love them. Firstly, kinship care is traditionally woven into the society, that it is natural and culturally appropriate, as Macron explained. The second point that I really took in was Helma's quote, "If you try to convince someone, you try to colonize," in the context of not being over bureaucratic or over formalization of kinship care, that professionals need to be mindful that it is not important what they know, but what the family needs, and that we need to focus on relationships. And focused on cross-country sharing of diverse context and learning from each other as partners. Duncan, through his video, highlighted on the multidisciplinary approach to support kinship care families and how critical it is to have social workers from the same community. As part of a Q&A, a majority of the reflection also focused on challenges across governments to support kinship care. We acknowledge that. And finally, we reflected on kinship care, whether being it as an alternative care or not. And the common reflection that perhaps came in is that it depends on the context, it depends on the family. We need to take into account that it is natural. And what is important is that we do not put it in a box, but how the family sees it, that it is culturally woven, that it can be sometimes considered as child protection, but also as prevention. As we now approach the end of today's webinar, I would like to thank our speakers for taking the time to share their work and insights. Emily, for moderating this session so well, and to all of you for joining and participating. Before we close, I would like to mention again about our community platform for child rights practitioners called Change Makers for Children. Most of you will have registered for this event already via the platform, and I hope you continue to engage on that platform. If you haven't already signed up to the platform, we really welcome you to become active participants and also become part of this global digital platform on this topic. And there are also many other topics that we discuss frequently on the digital platform called Change Makers for Children. Before we end, we ask you to please complete a final poll to share some feedback with us on today's event. This will only make us strengthen our future webinar series. We hope to see you again soon for our next Kinship Care webinar on Wednesday, 29th March. The title of that webinar will be Kinship Care at Times of Crisis and Across Borders. We will examine the importance of kinship care during emergencies and crisis periods and ways to support kinship care during these times. We will provide examples from Lebanon and examine the support needs of Ukrainian refugees in relation to kinship care. We will also explore the value of cross-border placements into kinship care and how these placements can be effectively supported, drawing on learning from the UK. We will share enrollment details on Change Makers soon. Thank you all. Please do fill out your polls. Thank you.